One of the things we're trying to do is to try and tell the story of how people are making social care work.
Not my background, come from banking, but really enjoy what I do. And my main aim is just to provide and promote the standards amongst the staff to give a really good service to these vulnerable people that find themselves having to come into care. We're very much into dementia. Quite a huge population that are starting to come into care do have some form of dementia, Alzheimer's and capacity issues, and respite. Because we're only such a small home here, we can't keep certain beds just for respite, and so many families that are in the community that need that, you know, that little bit of a break, and they feel like they're coming on a holiday. I can only do as I have a vacancy, whereas this will hopefully be able to provide somewhere where people can pre-book. So we knew that for Valley View to stand still as it is now, it is not where the future's going to be, because by the time someone does need to come into care, the needs are so much higher.
Decided that we'd base it on the worst business model going, which was to charge our customers the least, pay our staff the most, provide permanent contracts rather than 0 hours contracts, and we'd aim the business in the first instance in the Upper Valley area of Calderdale, which we've felt there was a lack of services. I've worked with 60, 70 different local authorities and NHS establishments. The thing that I find really refreshing about Calderdale is it's creative, it's innovative, it's solution focused, positive, and there's lots of informal networks of people working together to achieve something which you couldn't possibly achieve in a singular format. When my son told me that the roads were closing on Boxing Day morning, we lost £25,000 worth of stock. Our retail shop was 5 foot underwater. Staff team were absolutely superb. Of course, it's Boxing Day, rescue services were finding it difficult to come through. Most people were on shutdown for the Christmas break. We did 529 care calls. We had at least 20 carers whose houses were flooding at the time whilst they were out providing care. People were superb. They knew the calls that they needed to do. They were physically pushing people in wheelchairs, rescuing them out of their houses which were flooding, and then going up the street waist-high in water. And there was nowhere for these people to go. So our carers took those elderly people home and cared for them at home in their own houses.
On a Monday I go to Ives. We run a shop. It's up Hampton Lane. Everything clothes, sweets, biscuits, everything they can get their hands on. I go to Scope on a Friday, and we go swimming every week. Nearly every week.
We work with 38 schools at the moment, and over the next couple of months, for example, we'll be doing homelessness prevention workshops in these 38 schools. And the deals with the heads is that they ask the children to bring in a tin of beans, some toothpaste, some deodorant, etc, etc. And we get sufficient food and hygiene goods from those presentations to actually last us the next 12 months. We have an education centre whereby we undertake life skills training. We've got an allotment, so from March through to October we teach people to grow their own fruit and veg. We've always got waiting lists. I think in the last 12 months we've had, the minimum's been something like 20 people on the waiting list, but the maximum has been about 100 people on the waiting list. I've got a fantastic relationship with Calderdale Council. We've just acquired the building where you're making this interview, and we had to refurbish it. It cost us in the region of £80,000, and the council gave us a couple of teams, Day to Make a Different days, where they actually came painting and decorating. You can always pick up the phone to the commissioners, and also we work with Calderdale Adult Learning and Safer and Stronger Communities.
And I go to advocate groups every fortnight with Karen. I got an award last time from Advocate. This house were up for tender before, so yeah, and I took it to social services.
We have a member of the contracts team who we have a communication deal with daily if we need it. It's always there, very supportive. We want to make our clients' lives add a bit extra to their fulfilment of their life. But on a daily basis, we just want them to enjoy coming to our skill shop, and that when they go home, they've enjoyed their day.
Love, care and happiness, I think, are what goes into making a great social care provider. And it's happening. We just need to spread the word that these things can be made to work.